Hello, everyone. Good afternoon on this wonderful day. I'm Glorina Stallworth, the Prevention Unit Manager with the Division of Public Health, and also the former RPE Program Manager. So I am thrilled to be able to facilitate this panel this afternoon with this wonderful set of panelists who have just contributed so much to the work that we do. And so without further ado, you are in the COVID-19 pivot session. And this session, of course, came about because we've had significant challenges over the past 9 or 10 months. And as a result, many of us as preventionists have had to shift the way that we do things. So between social distancing, stay-at-home orders, Zooming out with teachers and staff and students, preventionists have had to be pretty creative in how they do their work. And so during this session, you will have an opportunity to chat and engage with 5 panelists who are RPE coordinators across the state. We have a total of 10, and they're going to provide their insights on how they've started doing things out of the box as far as their thinking and shifting and pivoting the work that they do in their local communities. Before I allow them to each introduce themselves, I want to quote the great Maya Angelou. You can't use up creativity. The more you use, the more you have. And so I think that this panelist is going to exhibit that this afternoon in the work that they're going to be sharing with you. So on our panelists, I want to introduce Nicole Schnarrs, who is from Promise Place, Laura Carper, who's safe of Transylvania, Omar Godwin with Families First, Haley Leva with Orange County Rape Crisis Center, and Tracy Dunstan with Safe Space. So what I'd like for you to each do in that order, if you would, share your pronouns with us, and if you could just share just a little bit about your community, and maybe one thing that makes your community very unique in terms of prevention needs. So let's start with Nicole.
Okay, hi everyone. I'm Nicole. I go by she, her, hers pronouns. I'm at Promise Place in New Bern, North Carolina, which is in Craven County, and I also cover Jones and Pamlico. And what's special about our community is while Craven has a population of 100,000 people, Jones and Pamlico are very small and they're geographically separated. So it's really important for us to get out and about in the community because it's really rural also. So I can't rely on internet to do everything. I have to boots on the ground approach is kind of how I looked at it.
Okay. Laura? Thanks a lot, Nicole.
Hey there, my name is Laura Carper from Safe in Transylvania County. We're also a really rural county with about 34,000 people. Community needs, I think, as far as like specific community needs for prevention programming would be addressing like really rigid gender roles, domestic violence, dismissive attitudes towards bystander intervention, and household substance abuse. Kind of like what Nicole was saying, we can't really always rely on internet access, either because in the mountains, our internet, my internet's gone out like 3 times already during this conference. And then also we can't always assume that the students that we work with or the youth or whoever that we work with have access to internet. Or even that they are learning in safe environments if they do have access to internet. So they may have family members who aren't necessarily supportive of what they're learning.
Okay, great. Omar?
Hey everybody, I am from Families First. Out of our office is out of Whitefield, North Carolina, but I serve both Columbus and Bladen counties. So there are 2 rural counties with 3 different school systems. So we have Whitefield City Schools, Columbus County Schools, and Bladen County Schools. I have the luxury of working in all 3. Each school system has been different as far as like handling the pandemic. I've done both virtual and in person with both the students and the staff and admin, which we'll talk more about later in the call. And glad to see y'all's faces today, be here.
Thanks a lot. We'll have Haley and then Tracy.
Hi there, my name is Haley. My pronouns are she, her, hers, and I work at the Orange County Rape Crisis Center in Chapel Hill, North Carolina. And I think something that makes our county really unique in terms of doing this work is that obviously we associate Chapel Hill with the university. So we're working in a town that's really revolving around the university, but there's this whole other section of our county that's pretty rural. So it kind of requires two pretty different strategies to meet the pretty disparate and varying needs across our county.
Tracy.
Hi, my name is Tracy Johnson. I'm not sure why my camera isn't working.
Okay.
However, my work is located in Franklin County, and I work with Safe Space. And we're located about 35 miles from Wake County. And what makes our community unique in terms of prevention program and needs is that we are a very rural community with transportation, technology, and online unemployment and lack of affordable housing opportunities. Due to the fact of lack of buy-in from the powers to be, which seems like they're only scratching the surface and not really dealing with the root of our community issues such as public health, mental health, emotional well-being for our community to thrive equally. Our programming is vital to help shift our culture norms and changing the narrative that everyone should feel safe and be safe, and knowing that they have an agency here for them, and together we can make a difference.
Great. Thanks, Tracy. So as you all can see, we have a diverse group of community of communities that are represented here. We've got rural, we have those counties that surround universities. We also have those that have limited resources. But I think the common thread that we can see is, number one, there is a need in all these communities for the prevention work that we're doing. But how do we do it? In times like this, when not only is the work changed that we're doing, but also our lives have totally changed. So even in our personal lives, we've had to make that change. We've had to make that pivot. So what I'd like to pose to the panelists is, how has your current programming, how does it look different from pre-COVID times? So tell us what you have had to do, and then what are some of those strategies that you tried while you were learning what works? So everybody's got a trial and error period, right? So what are those things that you did that you just had to figure out if they work? Tell us a little bit about that.
Well, I'll go first. I didn't.
I'll go first.
Okay, I guess we'll go with Omar then, and Nicole next.
Okay. I kind of like freaked out a little bit that first week during the pandemic. After everything shut down, I was actually in the middle of shifting boundaries. So I immediately had to scrabble and figure out like what worked until schools and everything was back in. And as far as our agency, what we started doing was weekly Facebook Lives on self-care, gender roles. We provided agency info because a lot of people in the community didn't know who we are, and being active on Facebook proved to be pretty imperative. Through that, I was able to work through the summer by like gaining us some new, I don't want to say, yeah, I guess clientele or a new population, the Department of Juvenile Justice, who we never used. We got to go, and I went in person and socially distanced. That was interesting. I also did a virtual human trafficking training for the staff and admin that they asked me to do because one of the school admins for Whiteville City Schools was at one that I did for Latino families right before the pandemic. So I was able to use that. And some other unique things I did, we have a billboard, a marquee in town, in the middle of town, and that proved to be helpful for me, letting people know that I could pretty much speak about anything, and let the community know that we were there, and we were able to put up prevention billboards for the first time since the pandemic. So, and as far as the schools, most of the schools I still, like I said earlier, I went to, but I did it in a socially distanced way. I had to make sure I was safe, and then the kids online participated as well. In some schools, they did not. So that was a little difficult and discerning, but I understood it was still new for the teachers as well. So that's all. I think that's all, if I answer your question, Glorina.
Yep, you certainly did. That was great. And we're going to talk about some of those challenges coming up, but thanks a lot, Omar. That's really exciting. So I'll turn it over to Nicole.
So I took the RPE program over right as COVID was happening. And basically what I noticed first was that it wasn't in schools or the colleges that are here, or we also have transitional program housing, and we're now in those areas. So we definitely spread our message further than it was when I first got in here, but we were having a hard time getting in the schools because of COVID, and they didn't want to let strangers in for no reason, essential people only. Basically what we did was create an online version of Safe Dates. I started a podcast, which has been a lot of fun, and it's free. It was super easy to do, and a lot of people listen to it. And we make video content and put that out on the internet.
I'll kind of piggyback off of that. When the pandemic first hit, I was also taking over the RPE program. And my background is in public school teaching. So teaching in person is my style, my jam. And so I think a couple of questions came up for me. There was some self-doubt that definitely came, like how do I show up? How do I do my job now? How do I create connection? But also, how do I honor myself and my own feelings around a lot of uncertainty around the pandemic? So finding that balance. And as Glorina said earlier, there was a lot of throwing things at the wall and seeing what sticks. Social media and online presence was definitely something that helped. And also partnering with organizations that we had a partnership with, but not as strong. So a lot of like digital collaboration between multiple like websites and social media platforms. So not just our social media platform was a way that we were able to kind of pivot. But I think the biggest thing for me is the connection piece with students or with youth even. Because of ways that we aren't always in person and boots on the ground. And even though throughout the pandemic, I have been in schools in person, mostly for high schools, middle schools was a little more difficult. But that creating connection piece was a lot harder because we're not in front of them as much. And so I think having that multi-layered approach of working with students and working with youth, not just in a prevention role. For example, I'm a yoga teacher, so I teach trauma-informed yoga. At one particular school, this is my second year teaching yoga there. My previous role at my agency was as a youth advocate. And I've noticed that because they already knew me and they saw me in a different context, it was a lot easier to have those really hard conversations. So I think that's something that we kind of threw against the wall that actually stuck, was showing up in different ways other than just a prevention role that really helped to create that connection and relationship with people.
Great. Is there anyone else that wants to share on this question? This is really exciting. So Haley, were you about to say something? Yeah.
Sure, I thought I said Tracy.
Yes, I would like to share.
Yeah, go for it.
COVID, we were already faced with the challenges of not being in school, so we had to be creative before COVID even hit. And we had to reach out to our non-traditional partnerships, like with sororities, the Boys and Girls Club, and implement shifting boundaries and safe dates and bullying prevention. We have had to be innovative across the board with our RPE program, so that we could get the results that We were looking for the outcomes from the program to just be available to educate our community and our youth with safe dates and shifting boundaries. So we already had to hit the ground running before COVID. And it's been very, very challenging, but we were getting the work done.
Great, thanks, Tracy. I think Haley, you were about to say something?
Yeah. Yeah, I resonate with a lot of what's already been shared about spaghetti throwing and challenges and all of that. I think my approach really early on, which I learned a lot from, was that so school was no longer a thing in March, and then we kind of had this summer break. And that was my time to really go hard on like, oh my God, we can't do our normal programming. Like, what are we gonna do? And I think we were able to be really creative during that time in terms of creating virtual programming. We have a YouTube channel now where we have videos that we've created that kind of boil our prevention messaging down to the essentials, and we accompany those with lesson guides, worksheets, information about what to do if a teenager discloses sexual violence. And we've been helping teachers to implement those in their own classrooms. As well as we've been doing sort of Zoom, Google Meet synchronous programming with teachers, which I've been really surprised that teachers have been as open to that and wanting that as much as they are. So it's kind of this feeling of like, we're not going to be able to do anything that we do was not true. And that's kind of a big thing that I've learned. And yeah, a lot of the same kind of doing a lot over social media. During this time, we've started a teen-specific Instagram account and a Spanish language social media accounts as ways to keep folks engaged and get new folks engaged in new ways. And I think a lot of the pivot for us too has been a lot of what Tracy has mentioned, looking to non-traditional partners, looking to folks in our community who are meeting people's basic needs, and we know that those are places where survivors are, and yeah, getting our messages out in food distributions, mutual aid efforts. We created a consent and COVID campaign on social media and created masks and hand sanitizers as ways to stay really relevant with what's going on in the world, and also still be talking about consent.
Thanks, Haley. This is really good. I am particularly proud because I've watched all of these grantees over the past 10 or 11 months just really make some major changes to your program, and just to see how you all are now. You have billboards, podcasts, you're doing things, you're doing virtual programming. I just think it's absolutely amazing, the trauma-informed yoga. And these are things I just want to say as we go to the next question, is that these coordinators received an additional only $10,000 from the RPE program to just stop what they were doing and totally look at their work that they were doing and figure out new ways to do it. So $10,000 may sound like a lot to some people, but it's not when you're thinking of ways to be creative and look at other resources. And as they've talked about, and we're going to share a little bit later about some of those non-traditional partners and some of those non-traditional places. So as you sit and listen, I just want you to have some framework for this work that's done by these people who are boots on the ground. And again, kudos to you. So are any of you still able, some of you have alluded to it already, but are you able to still work in the schools? And for those who aren't working with the schools, what are some of the kinds of changes that were needed? I think many of you have mentioned the virtual programming. What were some of those other changes that you had to make?
I'll jump in on that one. So yeah, I am still in the schools, mostly just the high schools. A lot of the middle schools found it really hard to fit the programming into their school schedule. So we created pre-recorded videos each week and put them onto Google Classroom, and then included like some quick check activities, polls, even some creative activities into Google Classroom for the middle school students. For high school students, instead of having a 14 session or even like a 12 session Safe Dates program, we've condensed it down to 5 90-minute sessions, which is really hard to fit all of that content into 5 90-minute sessions. However, we did this in order to accommodate A/B scheduling for in-person school, and then also for the online learning path as well. So we were still able to hit all of our schools across the county, just in different ways. So there's a lot of condensing, which doesn't really feel great, because I feel like there's a lot of conversations that were a little shorter than they needed to be. But that was one of the ways that we accommodated all those different schedules.
Thanks, Laura. Anyone else want to jump in on that?
I'll talk
Any
a
other-
little bit.
Yeah.
Oh, sorry.
No.
So we are not in any schools, but all of our information is. So we've made crisis cards that have mental health phone numbers, including ours. And on the back, it's a what to say and what not to say to someone we experience in a crisis. We also made suicide prevention cards that have all the suicide prevention phone numbers, our crisis phone number, and everything has a QR code to our Instagram or to our website. So basically what I've done is, no matter what piece of information you get from Promise Place, you will immediately come back to Promise Place. So that way we can give you resources for safe dates, RPE or therapy or whatever you might need. It is super easy to navigate everything that we've given to schools. And we've given schools, post offices, police stations. If there's people in a building, our stuff is up somewhere.
So I would like to add from what Nicole dropped off. We're doing the same thing. We have increased our outreach efforts. Even on Veterans Day, we partnered with the Franklin County Veterans Services, and they did a handout to their clients, and we also partner with that with our handout to just spread the message about safe space and letting people know that we are here, and our programming is available for any youth that wants it or the parents that want it for them. And we offer our sessions, we offer now group sessions or either one-on-one session, and we also have flexible scheduling for these sessions. And our non-traditional partners have really been very helpful for us, even like the local barbershops. We did the family prevention social media campaign where we created our t-shirts that says level up healthy relationships. We also created the mask that says level up healthy relationship. We putting our efforts toward the community to let the community know that we are here for them. We're also in the process of implementing our very own youth-based healthy relationship website. We're so excited about the website that we are creating just for the youth to be able to access that information in their private time, and they can learn and gain knowledge at their own pace. So we're super excited about these things that we're having to create or invent or reinvent, but we're determined to get that messaging out there. We're determined to give our community what it needs to thrive and be healthy.
This is great. Anybody else?
Yeah, I was just gonna add on to what Tracy said. Yeah, our barbershops here have been pretty helpful too with the mask. So versus using like the regular mask, I ordered a bunch en masse. So it's gotten the message out, and I see them all around town, and our hoodies. So that's been pretty cool. And understand, like in a rural town or rural county like Columbus and Bladen, our billboards have been very bold. So I'm proud of the response there. So that was it, guys.
That's great. That's a lot though. I'm super jazzed about this because I mean, just watching what you all have done is amazing. Creating websites, you know, specifically for the youth and the crisis cards. I mean, I think it's probably pulled things out of you and your prevention programs that you probably didn't realize was there. And so it's great hearing about it. So I'm super, super excited about it. You all have kind of answered this question a little bit for those who are in the schools, but for those of you who may not be able to physically be in the schools, are there any additional strategies for continuing to reach the youth that you'd like to share? I know Safe Space, Tracy, you've talked about the website that you're creating, and you all have talked about some of the swag, the hoodies and the level up shirts, the crisis cards, but is there anything else, any other products that have come out of this COVID-19 experience as it relates to the schools?
We still have our consent posters that we have readily available for our community. We're always coming up and thinking of new ways to reach our community. And I know that recently we even had a radio ads. We're constantly could put articles in our local newspapers. Also, just getting that information out there to let everybody know that we do have community education readily available for anyone who wants it. And we have another implementation of shifting boundaries coming our way. So this is not such as product, but we did a presentation with Zeta and on a local level. So they reached back out and now they want us to implement shifting boundaries and safe dates on a national level. So we're super excited about that also.
That is great. When you say Zeta, Tracy, are you talking about the sorority?
Yes, I am.
Wow. So that would be Zeta Phi Beta.
Yes.
That is amazing. So you'll have to keep us posted and keep the coalition posted so that we can share that information statewide. That is awesome.
And also this summer, I was able to do healthy relationship with North Carolina Council for Women. Also, they reached out and wanted that programming. So we were super excited to deliver that also.
That is really good, because what you've done is you reached across the funding lines. Because for those of you who may be on the call and that are not familiar, the Council for Women is also a government funding source. So to be able to reach across and extend that olive branch and do that work, that to help build that capacity even more, that is amazing. That is great. Kudos, Tracy.
So much. Thank you.
All of you. This is just so exciting. So as you can see, a lot has been birthed out of COVID-19. And so one of the things that I've been saying for months now, as it relates to our prevention work on the ground, is that everything that came out of COVID is not bad. This is the positive side. So I'm just thrilled. I mean, even at the fact that, Laura, I noticed you said you pre-recorded sessions. So what we're doing is also building sustainability across the state, because you've got those products that are out there that will continue as we hopefully come out of this within the next several months. And so I'm just excited. I could talk about this all day. I just think this is amazing. So we know that even with success, there's always those challenges, right? And those are those things that come up that we didn't expect or we didn't anticipate. So what are some of the challenges that, you know, you're facing while you're doing this COVID pivot? And we know that everybody doesn't always have online access in some communities. And so that's one challenge that's pretty obvious. Not only talk about that, but can you just share some of those challenges, both expected or unexpected, that you have faced?
I'll share a challenge that I had. So because this happened, I was teaching online, but it was a live Zoom class. And I was teaching about breaking gender stereotypes. And a student's parent was within earshot and did not like what I was saying about equality and how different not all relationships are heterosexual. Not all relationships look the way that you may think they look. And we started talking about some interpersonal issues that can pop up in varying relationships. That gained a lot of traction amongst parents in that particular school. And it went all the way up to the superintendent within a couple of hours. So that was definitely an unforeseen challenge that came up. And then even, talking with the superintendent and talking with the school board, they said, they're like, if this would have happened, in the classroom, probably you wouldn't have heard about this. They probably wouldn't have gone home and talked to their parents. And so that was a huge check for me, and being mindful of who else is in the room and who else may or may not be supportive of the work that we do. Although most, parents are supportive, but in this particular situation, especially in this rural part of Transylvania County, where I was teaching, there was some real pushback and resistance to even just the topic of gender stereotyping, period.
So Laura, before anyone else jumps in, I'd like to ask you just a follow-up question. So was there a silver lining that came out of that? I mean, I heard you say that it went up to the superintendent. So was there anything positive that was yielded? Because we've had these challenges before with some of the prevention programming, and some of the other prevention coordinators can share that if they choose. But what was it that may have been something positive that came?
Out of that particular situation, I think some of the positive aspects of it, that people who do support the work, especially the people within the school board, say that it's really important for this, but also, finding that balance between something that Chris said that really resonates with me is pushing the needle. I think it was Gina earlier that said she has a really big personality, and I feel like I do as well. And so I talk about things. I'm like, yeah, this is like totally normal. Why wouldn't you talk about this? And so really kind of, checking myself at that, but hearing from community members and hearing from people that are like, yes, this work is really important. Can we collaborate to try to find a way to still keep pushing the needle without going in like a bulldozer, I guess.
Oh, that's good. I was hoping that it opened up avenues for more conversations. That's good to hear. Yeah, we don't want the challenge, but hey, we'll take the success that comes afterwards and the new partners, right? So that's good.
Yeah, and it did open up. I mean, there were some really great things that came out of this, and a lot of other people on this panel were saying as well that this opened up opportunities to partner with new agencies, and I've been able to do that as well with our local college, which is a huge breakthrough with Brevard College, and then also with Care Coalition that usually just deals with youth and substance abuse and substance use. But we're actually collaborating on a bar training coming up. So that's been really neat, this kind of community sense of responsibility. But as far as that particular challenge, yeah, it is a matter of like reframing the work and tailoring it to your population. And so with that particular school and that particular community, the way that I approach prevention is more about pushing the needle than it is about, walking in, hey.
Exactly. Thanks, Laura. Anyone else wants to share about some of those challenges?
I've experienced a similar challenge with parents, but particularly related to our surveys and data collection, which I wasn't necessarily thinking about when I went into it, because I was like, great, we'll just send like a SurveyMonkey link. It'll be really easy. But I think teachers in general are trying to be really communicative with parents and have everything going through parents, which in a lot of ways is really great. And we've been able to use that to our advantage in engaging parents in our programming more. But it also means that a lot of parents are seeing surveys that ask their students like what their sexual orientation is, what their gender is, and it's not just 2 boxes. And that can bring up a lot of resistance. And we don't always know when, students are getting opted out of our programming. So there's no good way to track sort of what's going on that end of engagement. And another thing is that we do a parent education series where I collaborate with our local domestic violence agency, their education folks, and we talk to parents about how to talk to their kids about various sexual health topics, from consent to social media to sexting to digital porn literacy, all those sorts of things. And in this process of it going virtual, we've gotten a lot of support from the school district and have gotten that more baked into what they provide parents in general. But a downside to that is that there's just so many more layers of approval before we can get that information to parents. So before we would just coordinate directly with counselors and social workers, and now there's like 10 extra people who have eyes on our programming and can kind of poke holes where they see things that might be a little bit controversial or not, just in line with parents, what parents are typically hearing, but at the same time, that's the information that they're seeking. And then there's the stuff, a lot of what's been mentioned around internet access, particularly in more rural areas, and then just reaching rural parts of our community in new ways.
That's great. Anyone else? This is really good. And you all have definitely stepped up to the challenge. Yeah, when you're using virtual platforms, we all have learned that you never know who's in the room, you never know who's listening. And so there's that extra step in making sure that whatever we present is something that, of course, we can always stand behind, right? Okay, so we're down to the last few questions, but I wanted to ask you, we've talked a lot about those traditional partners, and you talked about sororities and fraternities and beauty salons and barber shops. And so what are some of those other who are some of those other non-traditional partners? And I'm going to add a little twist and say, where are some of those non-traditional places? Because I'm also hearing not just the partnerships, but some of the locations. Nicole, you made reference to post offices. So what are some of those non-traditional places and partners that you have utilized or tapped into during this COVID-19 phase?
So on top of the post offices, we are actually pretty lucky to have a Spanish-speaking support specialist. So everything that I've made has been translated into Spanish and is also being given out. And then on the podcast, I also do Meditation Mondays just because I like it, and it gets a lot of listens actually. But I also have her translate the meditation script into Spanish, and that gets more hits than the English version. So as far as, I think that's great. We're really lucky to have her.
That is great. Yeah. So I like the way you all have also translated many of your materials into Spanish. And so that's really an added plus. What are some of those other places and partners?
I know earlier she said she had the Zetas. Well, I was lucky enough to get the local Deltas. And these girls around Whiteville, these Deltas are busy. So through that, like literally we got a lot of social media clout. They wanted to be, in front of the agency, taking pictures. Like prior to the Zoom, they had it was a nice little build up. So that's actually the last Zoom class that I did do was with our local Deltas, and that was pretty cool.
That is pretty cool.
Yeah, so and as far as our community, what you have to understand is like the Black community and mental health, it is not one of the things around here that they typically like to talk about. So it was nice that they brought that awareness to the forefront. And while our main focus was Black community and community, sorry guys, I'm still getting all over the place. While our focus was mental health in the Black community, we also got to discuss prevention and the services that we provided that they didn't know. And they were also able to spread the word. And forgive me for stumbling, y'all.
No, that was really good. Let me just stop and hold the space for a second for you, Omar, to say our thoughts are with you. Many of you saw in the chat that Omar's mother is ill with COVID-19 and she's in critical care right now. So our thoughts are with you and we just appreciate you being such a trooper and being on here. I can't say that I would be able to even focus enough to do a panel. And he's also had some other losses recently from COVID-19. So we pause to say thank you so much, Omar, just for being here. And our hearts and our thoughts are with you during this time. But that is great that you tapped into the deltas. Hey, we will take a photo op, right? If it's going to help us get prevention work out here, we'll smile and we'll do it for the sake of the work that we do. So thanks a lot. Anyone else that wants to share those traditional places?
I would go. Glorina.
Yes, please.
We were also partnered with a sister to the Eastern Star organization, Iran Court 55. I will be implementing cyberbullying presentation with that organization. And we also work with Equality for Women of Color through Vance Grambling Community College. And we also have partnered with Partner Innovation Mental Health Healthcare. They help us with some of our program funding needs as it relates to summer camps or coaching boys to men or iron to iron presentation. And yeah, that's it.
Well, that's a lot. That's good, Tracy. That is amazing. You all really tapped into some amazing resources. I just, even each month, just so those of you who are non-RPE recipients, if you're on the call on sharing as part of this panel, each month we do RPE support calls, and just to hear what is coming out of COVID is amazing with not just only these 5 prevention coordinators, but the other 5. So this is great. I mean, you all have to give yourselves credit. This is amazing. Anyone else? And then we'll go into one of our last questions so that we can have a few moments for additional questions from the audience.
Yeah, so even though it's a traditional partner, which would be Brevard College, I think a kind of non-traditional way that we've been carrying out prevention is that we've been doing these small virtual circles where we do kind of mini training sessions with the RAs. And then the RAs are the ones taking those conversations out to their dorm rooms. I feel like that's been huge as far as creating those conversations that need to happen. And I think it's also a check for us because we're not always the one that need to be doing the work. We're not necessarily a part of that culture. And so it can't be us. We can't expect students or, young people to open up to us or want to have those conversations while we're in the room, and so taking those little mini sessions out to the RAs and the RAs having those conversations with their dorm rooms has really been great to see, and then also helps us get that information out to a wider base than if it would just be us.
That's a real creative strategy. Really good. So it's okay. The other thing we're seeing is that it's okay to share the message and train other messengers. Because if those are the people that can help us spread our prevention messages, we're good with that. So that's really good that you tapped into those resident assistants at Brevard. Okay, so one of the last questions, are there things that came out of COVID? We talked about the products, but are there practices or strategies that came out of COVID-19 that you would say as a preventionist and as a prevention coordinator that you will keep even once COVID goes away, which we hope is soon, but what are some of those things that you said, man, this is really good and I'm gonna hold on to this?
I'm going to hold on to those non-traditional partnerships. because they seek after you. And if you seek after me, I'm going to deliver.
That's what I'm talking about, Tracy. That's good. That's great. That's good. Anything else?
Oh, sorry.
No, go on, Nicole.
No.
Yeah.
We're definitely going to keep the podcast. It's free. It's a lot of fun. We can interview anybody. It allows the public to also contact us with questions or basically anything, because they have access to every sort of social media thing that we have. But I also have analytics, what countries we're in. We're in, I think last month when I did the report, we were in 14 countries and like 19 states, and it breaks it down by age, gender. So it's really good for when I do reports to see who's listening, what they're listening to, what topic everybody likes. Like we put polls out. Would you guys like to talk about assertive communication or setting boundaries? Because everybody seemed to really like that one. So it allows us to connect with everybody anywhere.
That's amazing. So we're going to tell Chris that we're changing our name to International RPE Prevention Coordinators, right? That's amazing. And these are things that, yeah, that's right. So Chris, if you're on and you're listening, we are now the International RPE program, okay? Anyone else? That's great.
Yeah, I think something I plan to bring with me when we reintegrate into the world is just the approach of kind of like zooming out and thinking more expansively about what prevention is, because it's not just, talking to kids about consent in a classroom. While that's, the thing that got me engaged and the thing that I feel really passionate about a lot of the time, it's also, meeting people where they're at, helping our community to meet our community members' basic needs. And a lot of that has come out in our partnerships. We've been working really hard to partner with the Chapel Hill Public Housing Department, and that's been one of the big food distribution sites in our county. So we've gotten messaging out that way about self-care and stress management and our Consent and COVID campaign. And it's kind of reminding ourselves that that violence prevention is a lot of different things. And those folks asked us for a pronoun training. So that's something that we knew they knew we knew something about, and it's building up those partnerships and that trust to where we're a resource for lots of things that help to end violence in our community.
That's great. I heard you mention the food distribution bags. That's another thing. Many of you, I know as prevention coordinators, created fact sheets and infographics to be included in these food distribution bags. And so that was another way that we have been able to build capacity across the state and expand our reach. An unfortunate situation, but we were able to use that. And I know many of you have talked about shared risk and protective factors and started looking at those as creative ways to do prevention. So just wanted to make sure that we noted that. Anything else that we'll keep after the pandemic is over with?
I think I'd like to keep putting out videos with the Boys and Girls Club. I feel like that collaboration really gains a lot of traction. And then also keeping the mindfulness-based practices. When we first started, talking about reframing prevention and what does that look like, and we talked a lot about mutual care. When I would bring in meditation practices at the beginning of class, or when we would put out videos on, creating healthy boundaries with your family, or journaling practices or anything like that, I think that it made a really great impact. And I would like to continue to do that after the pandemic, is, keeping those tools to talk about and sit with big feelings, especially around the pandemic, and then talking about, prevention on top of that. And then when students are already fatigued and they're sitting there with their masks on, looking at you like, get me out of here. I think that I would really like to keep that mindfulness lens in prevention work.
Yeah, that's excellent, Laura. Mindfulness is an important part, just period, someone's life, but especially now. And that's really good. I think it's amazing that you're doing it with youth. So that's great. You're going to keep that in Transylvania. Okay, so I think I first want to say, let me give an applause to all of the panelists. You all have done an awesome job sharing what you're doing on the ground in your communities and how you've been creative with this work during this pandemic. And so, as we've said, kudos to you. You certainly do rock in our name, AKA International RPE program. I think Dina's on the line, Dina Fulton, the new RPE program manager. So Dina,